Alright, so this is the newborn assessment. I would first go in, introduce myself, say, hi, I'm Kylie, I'm the nursing student today, and I'm going to perform a newborn assessment. I would perform hand hygiene and don gloves, and then of course verify the newborn's identity. So first I'm going to start off by looking at the head of the newborn. I'm going to look at the anterior fontanelle, and it should be soft and flat. I'm going to assess the suture line, make sure there's no abrasions or swelling of the head as well, and then also look at the posterior fontanelle, which will be smaller than the anterior. There could be bulging if the infant is crying, which would be normal if they're crying. Then moving along, I can look at their eyes, make sure the sclera is white, conjunctiva pink, look at their ears, tragus, and the pinna. And while I'm assessing their head, I'm going to go ahead and look at the newborn's mouth and the soft palate, make sure that is intact. And I can also test the rooting reflex by placing my finger on the inside of their cheek and make sure that they look towards that side and then begin to suck, which is a good sign. So after moving along from the head and the mouth, I'm gonna go further down and look at the clavicle, look at the extremities, and then start by assessing the system. So I'm gonna listen to the heart sounds, the breath sounds, and the abdomen. So first I'm gonna inspect and make sure there are no abnormalities of the skin. And then I'm gonna go ahead and listen to the aortic, the pulmonic, the Erb's point, and mitral areas. So I'm gonna go ahead and listen to that, and I'm gonna wanna hear S1 and S2. And afterwards, I want to listen to the newborn's breath sounds and make sure that those are clear and that there are no adventitious sounds. And then I'm going to listen to the bowel sounds, make sure that there are gurgles. So aortic, pulmonic, Erb's, mitral. And then I'm going to listen to the breath sounds, make sure that those are clear. You can listen on the front and on the back as well by flipping them over. And then I'm going to listen to the abdomen as well to make sure I hear gurgles. All right, and then after listening to the bowel, I'm going to want to palpate just to make sure that I don't feel any abnormal masses. And I'm going to want to inspect the umbilical cord for drainage and to see if it's still clamped. So after I do all of that, I'm going to move along to the extremities, palpate the extremities, inspect them. And while I'm looking at the arms, I can test for the startle reflex by picking up the arms and dropping them. And the infant or the newborn should fan their arms out and flex their knees, and then they'll relax. So afterwards, I'm going to move along to the legs, and I'm going to look at those pulses, inspect the skin color, and I can test the Babinski reflex by stroking the bottom of the newborn's foot, and their toes should fan out. So after I inspect all of those things, I'm going to inspect the genitalia. If this newborn was female, I would inspect the labia and make sure that there's separation. And some edema is normal, so I would just want to note that. And then check for vernix or mucus, which would be normal, and I would just document that. If this newborn was male, and had a circumcision done, so I would assess that and make sure that there are no abnormalities after that procedure. And then I would also palpate the testicles and make sure that there are two. After assessing the genitalia, I would then look at the buttocks, make sure that there is an anus, and just make sure that there is no tufted hair or a sacral edema, or a sacral dimple, excuse me. So I think that would be all of it.